Welcome back to the Knowledge Hub podcast. What if I told you there's a $1.2 trillion industry that's practically begging for new ideas, but where a single misstep could be catastrophic? That's the reality of digital health today. Everyone wants the next great tech enabled healthcare solution, but the stakes, involving patient safety, data privacy, and complex regulations, are sky high. So, how do you innovate without risking it all? The answer is something called a minimum viable product, or MVP. Now, you've probably heard this term in the tech world. It usually means a basic, stripped down version of an app to test an idea. But in healthcare, an MVP is so much more. It's not about moving fast and breaking things, it's about moving smart and building trust. A healthcare MVP isn't just a prototype, it's a strategic tool designed to prove, on a small scale, that a new idea can actually improve patient care and work in a real clinical setting. The first thing to understand is that the challenges are completely different. You can't just launch a simple app and add security later. From day one, even the most basic version has to be compliant with strict privacy laws like HIPAA. It has to be rock solid secure to protect sensitive patient data. A data breach in healthcare isn't just bad PR, it's a disaster. The second key difference is the user. In healthcare, your users are busy, often skeptical doctors, nurses, and patients. If your tool isn't incredibly intuitive and doesn't solve a real problem for them immediately, it won't get used. They don't have time for experiments. So a healthcare MVP has to prove its clinical value from the get-go, showing it can do something measurable, like reduce medication errors or help patients manage a chronic condition. The interesting part is how this changes the development process. Instead of building a dozen features, the smart approach is to find one specific painful problem. For example, instead of building a massive hospital management system, you might start with a simple, secure tool that just helps reduce appointment no-shows. You build only that core function, get it into the hands of a few clinics, and listen intently to their feedback. This allows you to validate your idea, gather real-world data, and build stakeholder confidence without a massive upfront investment. It's about proving value, not just building features. And in healthcare, that's the only way to truly innovate.